All right. Good morning. And we've got Commissioner Shea here as well. And I'll go ahead and call to order the joint meeting of the Travis County Commissioners Court and the Austin City Council. We'll take up item 1, receive briefings on COVID-19 related matters. And I think we have one caller on this that we'll go to for the Travis County caller portion now.
Judge, you said you were going to go to that caller right now?
Yes, please.
All righty. The first caller this morning is Ms. Janice Bookout. Ms. Bookout, you have 3 minutes.
Thank you. Good morning, everyone, and thank you for your hard work. This morning, I'll be sending each of you by email an updated document summarizing recent research with source links in many categories related to COVID-19, such as Travis County trends, Delta variants, vaccination and public interest testing, long haul masking, children and schools, business. It'll also include a link to a spreadsheet where CRT is tracking 5 county region data of disaggregated case rates, vaccine acceptance rates, and vulnerability data by zip code. And then a link to an infographic that is translated into Spanish and English, addressing vaccine hesitancy that you're welcome to use. When I look at the vaccine and case data from the Eastern Crescent zip codes compared to West Travis County, vaccination rates in the Eastern Crescent zip codes are currently 9% lower than West Travis County, while new cases per 100 since July 1st are 2 times higher in the Eastern Crescent, and the number of state-approved and federal providers are 2.1% more prevalent in West Travis County. However, community-based vaccination initiatives are working. For example, Central Texas Allied Health is one of over 500 approved providers in the county, but has delivered a disproportionately high percent, nearly 1% of all vaccines. More so, the people they're reaching from the zip codes of highest needs. For example, 54% were Hispanic Latino, 15% were Black, 15% were Black and 8% were Asian. This is compared to county data of 38%, 8%, and 3% respectively. They aren't the only ones either. Since the United Way funded initiative started in May, the ratio of doses delivered in West Travis County compared to East Travis County has reduced from 1.9 to 1.3. In other words, they are collectively closing the gap in the Eastern Crescent. Groups like Del Valley Coalition, Back Together Austin, the Center for Survivors of Torture, and many others have impressive results, and each of these groups have customized strategies for outreach and delivery that are all unique to their constituencies. I say this to say we cannot afford to lose any of these groups in their fine work that they're doing, reaching very specific groups that we to date have not reached. And additional funding initiatives are vital to ensure that they do. So whatever we do, we need to support these groups and make sure that they all get funding to continue their efforts, because it is working, but we cannot afford to stop. The document that I'm sending will also address other recommendations and concerns related to gatherings, schools, businesses, tracking of breakthrough cases. Am I at 3 minutes? Can I say one more sentence?
Sure. One more thing, Janice.
Thank you. And finally, I just would like very much for tracking to be done to understand whether that the time since the vaccine, the type of vaccine, or the vaccine batch quality has had anything to do with trends and breakthrough hospitalizations. Understanding this is imperative. Thank you so much.
Thanks, Janice. Thanks, Morgan.
Judge,
okay,
that was
so we'll
last
go
call.
ahead and get started. Thank you, Morgan. So we'll go ahead and get started. I'll turn it over to Dr. Walks for an update.
Good morning, everyone.
Morning.
Good morning.
I want to start by saying thank you to the people that have worked so hard at Austin Public Health to prepare this data. We have a large staff of epidemiologists who have been working hard to put in the cases that are presented to APH every day. And then they work diligently to research each case, whether the person's vaccinated, and in a lot of cases also go to the records once they're completed to get more information about comorbidities and the like. So I just want to say thank you to them for their tireless work. The first slide that we're going to be looking at is the slide that depicts the pandemic as we know it, have known it since last March. And we're starting to see our case numbers decrease over time. And that is an exceptional thing to see at this point, but we're still cautiously optimistic. We had 886 cases reported to APH yesterday. 72 is our 7-day moving average hospitalizations, with 604 COVID patients in hospital. I'm not seeing our slides right now, so I'm hoping that they're going to be put up while I'm talking. 604 COVID patients in hospital, 220 people in ICU, 170 of those are on ventilators.
I'm having trouble hearing.
Yeah, I think this.
Having trouble hearing me? Can you hear me better now?
Yeah, that's better.
Yeah, there are the slides. Good. I'll start again. We had 886 patients, COVID cases presented to APH yesterday. Our 7-day moving average is 72. We have 604 patients in hospital, admitted to hospital yesterday, 220 in ICU, 170 of them are on ventilators, 55 admissions, 66 discharges. We had 2 pediatric admissions. We're seeing a plateau, it looks like, in our 7-day moving average, which we're happy about. However, we do know that our case numbers in our schools have gone up tremendously over this past week. And so we're cautiously optimistic about whether that's this plateau that we're seeing is going to persist or whether we're going to see another increase in our cases. So we're still in stage 5. We have exceeded our staffed ICU bed capacity, and we should not stop our efforts as a community to keep our numbers going down by masking, social distancing, staying home when sick, and encouraging vaccination. Next slide, please. If you look at our MSA and the hospitalizations of patients in our local hospitals, this vaccine data is what we've gotten from those institutions that are reporting their vaccination rates. So this is not all inclusive of all of our hospital systems, but it does show that almost all of the people that are being admitted to hospital are not vaccinated, not fully protected. 81% are unvaccinated and 18.6% are vaccinated. Next slide, please. If you look at the data on this slide, we're looking at the admissions to hospital by race and ethnicity, and we still see a disproportionate representation of Hispanic and Blacks in our hospital systems. That is consistent over the length of this pandemic. Next slide, please. And if you look at our admissions to hospital based on their county of residence and zip codes, we're seeing that 52% of those admitted to hospital are from Travis County, 21% Williamson County, 8.7% from Bastrop County. And the zip codes that are represented are those also that have lower vaccine uptake and higher social vulnerability indexes. Next slide, please. If we look at the race and ethnicity of those who are admitted to ICU, you're seeing a breakdown that's similar to the admission rates that we discussed on the previous slide. 81% of those admitted to ICU are white, with 35.7% of those being Hispanic, and Blacks represent 5% of the admissions to ICU. If you look at our next slide, please. This is a breakdown of admissions to hospital by age group. And as we talked about in previous sessions, there's an increase in the number of admissions of pediatric cases, those under the age of 18. And for the period of July 1st to August 29th, we've had 108 admissions to hospital from the pediatric cases, and 33 of those have been admitted to ICU. During the last weekend, we did have a pediatric death, unfortunately, and that individual was a child who had comorbidities and had been on a ventilator for over a month. Next slide, please. We look at our death rates and look at how we're doing as compared to other major metropolitan areas. Travis County still is doing well as compared to other major metropolitan areas, with 84.41 deaths per 100,000. And I had a request to give some more information about deaths according to race and ethnicity. And you'll see that Hispanic individuals have a 51% deaths of those total deaths that have been reported. Whites, non-Hispanic, have 30% of the deaths that have been reported. Blacks, 12% of deaths that have been reported. Asians, 2.61% of deaths that have been reported. And the other categories listed as 3.39% of deaths reported for 2021. The representation of deaths by Blacks and Hispanics is again in excess of their representation of the total population, as is their representation for overall disease. Our efforts to vaccinate our community need to continue. We need to continue masking and social distancing and staying home when sick. And in addition to that, we now have a new tool in our toolbox, monoclonal antibody therapy, and we have started a campaign to get the word out to our community that if they test positive, we ask that they seek help from a healthcare provider, and also ask about whether or not they're eligible for monoclonal antibody therapy. It does decrease hospitalization for those who are at risk for severe disease by 70%. It is not a substitution for vaccinations. However, those who are positive for COVID-19 are not able to be vaccinated until after they recover. So we're asking those who test positive to inquire with their healthcare provider and see if they are eligible for monoclonal antibody therapy. If you look at the next slide, we've had a marked increase in school cases across the state of Texas, with schools reopening and not using the mitigation efforts that we used last year to decrease case spread in that environment of congregate setting where children are in close quarters and not social distancing. Just in the last week in Travis County, we've had 817 cases with 17,240 close contacts identified. As TDEA is not requiring quarantining at this time, not all of those close contacts that have been identified have been in quarantine. There have been 67 clusters identified in Travis County ISDs, which is also of concern. Children under 12 cannot be vaccinated, so wearing masks and protecting them from COVID-19 in schools has been recommended by the CDC, the American Academy of Pediatrics, many other groups, as well as myself and other health authorities across the state. We have a couple of school districts who have closed entire grades, and we're really encouraging everyone in our community to protect our children and send them to school masked. We look at the data in the next slide. This may be something that you're familiar with from previous presentations. And it does show the effectiveness of mask wearing. This is depicts a dummy that is being masked with different types of masks, and it shows how vapor is emitted from masks depending on how well the mask fits. And as you can see, there is some leakage around the mask at times due to fitting of the mask and tightness of the mask around the chin, whether or not there's a snug fit on the cheeks, etc. So you can see how the vapor can be expelled and leak and not make the mask 100% effective. However, it does confer some protection for the emission of those aerosolized particles from someone who may have COVID-19. This I'm showing to show that it's important not only for the person that's infected with COVID-19 to wear a mask, but for the person who is being protected and not infected with COVID-19. If you apply a mask and then also employ social distancing, these vapors do not reach a person that you may be in a room with. So it's important for everyone to mask. I've heard comments during some of the school board meetings that I've been to where there's been some concern about whether or not wearing a mask affects the oxygen levels of the person that's wearing a mask. In the 2021 virtual meeting that was held by the American Academy of Allergy, Asthma, and Immunology, they definitively reported that mask wearing does slow the spread of COVID-19 and does not impact the oxygen saturation or the level of oxygen in a person's blood. Masks are not recommended for those who cannot safely wear a mask, such as people that cannot remove masks either because they're physically unable to or mentally incapable of doing so, or if they have a condition that would preclude them from wearing masks. Generally speaking, masks are safe to wear and effective in decreasing the spread of COVID-19. Next slide, please. The vaccines have been helping to protect the most vulnerable in our community, our seniors. And this slide that I've been showing each week shows that there are new facility cases that have occurred in the past 14 days. The increase is from 32 cases to 56 cases. 13 facilities reported positive sample collections in the past week and 8 from the previous week. Of the 25 resident cases, 24 of them were fully vaccinated. Of the 31 staff cases, 19 were fully vaccinated. The vaccine, however, is producing mild disease in the cases that are occurring in the long-term care facilities, and thus is supporting our assertion that severe disease is something that is not seen as frequently in people that are vaccinated. It's decreasing hospitalizations. These individuals have been able to stay in their long-term care facilities for care. So we continue to recommend vaccinations, and we will be giving third shot boosters as the next few weeks go on to help boost the immunity that's conferred by the vaccine. The next slide, please. I'm showing this slide once again just to indicate that the use of mitigation measures that's ongoing in our local bars and food establishments has continued to mitigate the spread of COVID-19. Their use of those protocols in their establishments has kept their staff cases to a low number, even through this Delta variant wave. And we've seen that we have had masks used in various establishments and business establishments across our city, which has helped keep our businesses open and our economy going. As we look to events, events are also starting to employ mitigation protocols and measures to help slow the spread. And this, we feel, will help to keep our numbers down. As we're in stage 5, we're looking at each event on a case-by-case basis and not only assessing whether the mitigations are being used, but also whether or not our public health, public safety, and health infrastructure can tolerate case numbers and crowd size. So going forward, each event will be assessed on a case-by-case basis as we're going through stage 5 and continuing to mitigate and hopefully continue to have our numbers of cases decline. Next slide, please. Next slide, please. This is just to familiarize everyone again about monoclonal antibody therapy. It can be delivered either by infusion intravenously or by subcutaneous injections. Our regional infusion center is delivering the medication by IV. It is a treatment that is given where patients receive antibodies to COVID-19. These antibodies cover the spike protein so that they cannot bind to our cells and cause an infection. The treatment needs to be given within 10 days of symptom onset. It does decrease the symptoms fairly quickly. It's important that people seek the counsel and advice of a healthcare provider so that they can be referred to the center if they are eligible. And they are, we've seen a good turnout and a good response from not only our medical community, but patients who have undergone the therapy have stated that they've had good response from the treatment. So we're happy that we're able to offer this treatment, and we're hoping that the public will continue to get care early on so that they can avoid hospitalization. The treatment is available to those who are at risk for developing severe disease, and the criteria include age over 65. It's available to anybody over the age of 12 who has a medical condition or history that would make them eligible. It's eligible for those who have lung disease, heart disease, diabetes, for those who are Black or Hispanic. It's for those who are at risk for severe disease and illness. And consult your healthcare provider if you're positive for COVID-19 to see if you're eligible. The next slide, please. We are making excellent progress in our vaccine efforts, not only through APH, but our collaboration with partners throughout the city. When I first got here in early June, our vulnerable population sat at 20%, and we are now down to 9%, which is extraordinary. The vaccine uptake has increased. Our partners and APH employees have been working tirelessly through many, many different means, including those that were mentioned by the caller earlier. And this is the way forward and out of this pandemic. And I hope to be able to report very soon that we've reached that 70% mark of those over age of 12 who are fully vaccinated. And with that, I'll conclude my remarks. Thank you.
Thank you, Director Stirrup.
Good morning. So first I'll start out talking about testing. On the screen here, you'll see that we have several options for folks to go in and get tested. We're at the George Morales Dove Springs Rec, at St. John's. We offer in-home testing Monday through Friday. All you need to do is call 311 or 512-974-2000. We're also working with our facility partners to offer testing in homeless shelters and other congregate facilities. So again, if you are sick, please get tested. If you are exposed to someone who tested positive, please get tested. When in doubt, please get tested. In addition to these free options offered by Austin Public Health, there are several providers in our community that are offering testing services. And just for context, our testing capacity is 5,900 per week. And you can see over the last week, we administered just over 3,600 tests. And so now when we're talking about vaccines, we see our cumulative total for Travis County or for doses delivered by Austin Public Health and Community Care are at 455,706. Our weekly total is 1,522. According to DSHS, 78.26% of our population 12 and over is vaccinated with at least one dose, and 67% of our eligible population is fully vaccinated. This data is current as of August 30th. We still have 250,000 eligible people who are unvaccinated. And so we will continue our efforts with our partners to ensure that we are reaching out to communities, that we're providing access, opportunities, and information to support the choice of vaccination. And just for additional context, as of August 30th, Austin Public Health has administered over 340,000 doses of the COVID vaccine. Of these, 300,000 have been administered through our static sites. Just over 10,000 have been administered through our pop-ups, and 9,556 through our mobile strike teams. And again, this slide is from DSHS, and it shows the data for the county broken out by race and ethnicity. The total number of shots in Travis County is just over 1.5 million. Items to note on this chart is that we're still seeing the disparities in Black and Hispanic communities with one dose vaccination, as well as percent of folks fully vaccinated. There were some questions last week about the other category, and this comes from the ways in which the different systems collect and report either folks who choose multiple races or ethnicities when disclosing on their form. And there's no way, DSHS doesn't break out biracial communities in the same way that we might do at a local level. When we look at our map, again, not too many changes, but it's still something that I like to see from earlier in July, where we had a lot of red, and that red indicated that we had communities that were below the 50% mark for first dose penetration. This map has a lot of green, and that means the majority of our community is above the 70% mark, and that's where we strive to be. The blue indicates those communities that are within 60 to 69%. And those are the areas that we focus on with our partners in the county to make sure that we are providing access, information, and shots. Um, in the yellow category are those areas that are 50 to 59%, and that's that 78705 area. When we look at the second dose map, that red is still there, but as we've said before, and we'll continue to say throughout this presentation, and you'll hear from the county collaborative, there are focused efforts on 78617 to make sure that we're providing access and opportunities for those residents to get their shots so that we can bring that zip code above the 50% mark. And of course, we continue to work in the areas where there is no green. And so this information, along with other information from folks on the field, is used to inform our strategies for first and second doses. And so this slide here just gives the body some situational awareness on our vaccine incentives. And so the intent was to focus on our hard to reach populations and encourage them to obtain their first or second dose of the COVID vaccine. And this was really on that movable middle, folks that have, decided that they were going to get the vaccine and either were waiting for a convenient opportunity or the full approval and the like. And so to receive the incentive, we asked individuals to complete a survey. And that survey was designed to get more information about their decision-making process to get a vaccine. We purchased 2,000 ATB gift cards in the amount of $50. To date, we've distributed approximately 1,650 of the gift cards with 350 left. We're still assessing the impact of this incentive on vaccine uptake. We're continuing to review partner cities and their experiences. Recently had some interaction with Harris County, who are reporting huge increases based on their incentive plan that is centered around a virtual or cash gift card rather than a store gift card. And it's limited to first and second shots only, not boosters, but we want to get our teams together to see what their approach was to have a more focused implementation. What we're seeing on the ground is here that where we've had a lot of uptake, it may not have been in the areas of that which we would have liked. And so if we were to do this again, wanting to not reinvent the wheel, but really rely on lessons learned in sister cities to figure out the best way to implement. Vaccine operations continue this week at our static locations, which are the Southeast Branch Library, the Little Walnut Creek Branch Library, and the Anna Lark Center. Those vaccines at the Anna Lark Center is staffed by the Central Texas Allied Health Institute, led by Dr. Jerica Thomas Hockaday, and supported by funds from Austin Public Health. The team will also be out in Pflugerville at the Harmony Science Academy. We'll be at the LISD Technology Building in Leander. And we expect that our mobile operations team will be at approximately 27 events this week. And those include various ACC campuses, select CAP Metro facilities. And once again, we will be at the Montopolis Flea Market. There is an abundance of vaccine in this community, and we are again, working with partners, informing community. You can visit us at www.austintexas.gov to find out which location this week works for you. But we really want the community to take advantage of the amount of vaccine that's available in our community. And so just to talk briefly about some situational updates on activities related to boosters and the impact of the full FDA approval for the Pfizer vaccine. Um, and so for boosters, the Advisory Committee on Immunizations Practices, the ACIP, has recommended a third dose after 28 days following the second dose for immunocompromised individuals. And so we take that into consideration for our planning. We're also looking at CDC changes and recommendations to determine whether we need to include different populations or to determine shorter intervals between boosters or additional vaccines. So all that to say is all of our planning is based on guidance from the CDC and what we know from the FDA. And so to that end, we're still waiting for approval for the PD vaccines, but we're planning on what our systems would look like in Austin Health Force. We're planning on what the staffing would look like because pediatric immunizations are a very different animal from um, older youth and adult vaccines. And so making sure that we identify any staffing needs or gaps early and that we align our processes to meet that community need once it becomes online. And so again, more about booster planning. What we know that's different from the first time is that we are not a hub, right? We're not a hub. There's plenty of community vaccine in community. There's not this kind of wait and see how many doses we're going to get from the state this week. We're taking into consideration with our planning that vaccines should be free. We're going to have both mRNA vaccines available at all of our sites. So any individual, whether you got Pfizer or Moderna, you can come to APH and get your booster shot. Um, right now, we are scheduling that third dose for immunocompromised, and you can either do that online or call 311, and those calls will be routed to our equity line, and that team can walk you through scheduling an appointment. And of course, you always have the option to walk up to any of our locations and get your third dose if you are immunocompromised. Pre-registration just means your wait might be a wee bit shorter. Um, and with all this, the main focus of our operations will still be on those that are unvaccinated or not fully vaccinated. When we look at our media and community outreach, we are using what has worked for us in the past. We continue to use our PSAs that feature our community champions. We've partnered with Travis County and Central Health on the Let's Stick Together campaign, and that is a full digital marketing campaign on social, digital, and television advertising, and we are expecting to start that later this week. We've resumed our weekly media Q&A that gives the media opportunities to ask questions and for APH to provide guidance to communities. We continue to respond to interview requests and also requests from different bodies to give information. We have our APH Facebook page that's available in Spanish. We've worked with our partners to make sure that we've captured the cultural nuances that are necessary to reach our Spanish-speaking population so that it's more than just simple translation. We continue to support PPE events in community. And at those events, we take advantage of, at times, not only offering food and covering other basic needs, but making sure that we're giving out information about vaccine and not simply where we're going to be, but answering any questions that we can about how vaccines work and impacts on bodies and being able to dispel any fears or disinformation that's out in community. And we also continue to support our MVP outreach, which is our mobile vaccine program. And that is a great program that combines, the on-the-spot education with vaccine. So if you get somebody and you talk them into the vaccine, they don't have to say to you, I'll call APH tomorrow. You can get that vaccine right then and there. And as always, I like to try to end my slides with some visuals of our APH team in action. We continue to be a full service health department. COVID vaccines or COVID is just one small part of our operations, and we will continue to be there and support our community. Um, these are shots of an event that we held at St. John's where we did food distribution and provided PPE as well as information about vaccines. This week, the team will be at Fiesta Grocery Store. We'll be at the Terry Road Baptist Church. We'll be at Gus Garcia giving out PPE and food. And we'll also be at the East Austin Neighborhood Center. Um, Another thing to mention, and I thought there was a slide and maybe I glossed over it when we're talking about immunizations. This is the time of year where the same folks who are out there working on COVID are getting ready for our flu season. And so we want folks to know that, it is that time. If you got it on your calendar, please get your flu shot. There's a lot of talk about keeping our schools safe or keeping our kids safe in schools. And so we continue to support parents with all those necessary childhood vaccinations that kids need to stay safe. And so, with that, I'll end my remarks and say thank you to the Austin Public Health team for the amazing work that you continue to do day in and day out. Thank you.
Thank you, Dr. Stirrup. I'll turn it over to Chuck, Chief Bailey, and I think